and good afternoon. Greetings from all of us at Apollo Hospitals and welcome to our FB Live session. This is Dr. Srinidhi Chidambaram and I hope you're all staying safe and keeping great health. We have been presenting FB Live sessions on key topics that each one of you should be aware of because knowledge is key to early recognition of disease. And you know that early diagnosis leads to early treatment and better chances of cure. And when the information comes from the top experts from various specialties, it is a great way to get factual and authentic information in this era when we are surrounded by social media myths and misinformation. Our habits and lifestyle make us what we are. While a lifetime of healthy habits like a balanced diet, regular exercise, and good sleep would enhance our health, the reverse is also true. If you abuse your body, you pay the price at the end. So to discuss one of the most common ways in which people abuse their body by getting addicted to nicotine, we are going to discuss this topic of how does nicotine affect the heart and the circulatory system. Nicotine, which is Nicotiana tabacum, is the type of nicotine that is found in tobacco plants, comes from the nightshade family. It is indigenous to America and it has been used as a medicine and as a stimulant for over 2000 years. Nicotine, unfortunately, is one of the most commonly abused products, a dangerous and highly addictive chemical. It can affect almost any organ in the body, from the heart, lungs, nervous system, and can also affect pregnancies and births. It can cause an increase in the blood pressure, heart rate, flow of blood to the heart, and many other complications, and also can cause withdrawal symptoms. Smoking is one of the commonest ways in which people use tobacco, but cigarettes itself is not only nicotine, but there are more than 5,000 chemical compounds in them, which are all harmful to the human body. And yet people consume tobacco in many ways. So to discuss this very serious health issue, which is nicotine abuse, and especially to discuss the serious effects that it could have on the heart and the circulatory system, I'm delighted and honored to welcome Dr. Vijaychandra Reddy, Senior Consultant and Interventional Cardiologist, Apollo Hospitals, Chennai. Dr. YVC Reddy is an internationally renowned interventional cardiologist with an extensive and versatile experience and range of professional work spanning over 26 years. He is one of the foremost and internationally renowned cardiologists with extensive experience in clinical, imaging, invasive and interventional cardiology, endovascular interventions, transcatheter valve interventions, cardiac device therapies. He holds an MRCP from the UK, from the Royal College of Physicians, London, UK, is an IBHRE USA certified cardiac device specialist and a British Commonwealth scholar in interventional cardiology from the University Hospital of Wales in Cardiff. Did his DM cardiology from the Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, and MD in internal medicine from PGI MER. A key opinion thought leader in cardiology with special interest in teaching and training, pioneer in coronary angioplasty and stenting techniques, and also particularly complex high-risk interventions, acute MI interventions, a large body of PCI work in cardiogenic shock with unparalleled outcomes. And his interventional footprint has a wide range from balloon valvuloplasties to MitraClip procedures, TAVR, as well as peripheral and renal carotid interventions, IVC filters, and so on. He has also been involved in pioneering the robotic angioplasty program in Apollo Hospitals, Chennai, and is involved with precision robotic PCI techniques with imaging and physiology optimization, and has also mentored and trained several interventional cardiologists and active on several medical advisory boards and quality improvement boards. Welcome, Dr. YVC Reddy. Thank you so much for joining us today on this FB Live. So over to you now to discuss the subject of nicotine.
Thank you very much, Srini. It is a kind introduction. See, we always, when we talk of non-communicable diseases in our country, we know that the biggest killer disease is the coronary artery disease. The reason why the heart blood vessels gets narrowing is something called atherosclerosis. What it means is the cholesterol in the blood gets chemically modified, gets deposited in the walls of the artery, and slowly there is an inflammation. And at some point of time, suddenly these plaques rupture, blood clots form, and they close off the blood supply and cause heart attacks. Sometimes, if you are lucky, the blocks are not 100% and you'll get only angina. So this disease is the major killer disease all over the world, and our country is no exception. So what does smoking cause to atherosclerosis? The important thing is this is one of the most rampant risk factors for this very, very difficult to treat medical problem. We have lots of procedures like angioplasties, bypass surgeries. We can tackle the blocks when they happen and then we can save the patient's life. But to prevent this from happening, we need to do a lot of preventive work where one should be aware of the risk factors involved. One of the foremost risk factors you rightly highlighted is smoking. Of course, high blood pressure, high sugar, high cholesterol, sedentary lifestyle, not having a healthy diet, psychosocial stresses, all are important as well. But this is one of the risk factors primum, a risk factor which is easily and without much cost involved can be eradicated. It's a totally modifiable risk factor, a risk factor which can be modified with no further additional medication in the most of the cases if one has willpower. So this is a very interesting risk factor. As you said, other risk factors like say, for example, high cholesterol, high blood pressure, you need a lot of medication, lifelong support for that. For this, no, one willpower and then a good effort, it can be done. Why does then? How does it cause it? That is an interesting question because nicotine, as you said, is only one part of the game. There are so many 7,000 other chemicals involved in the smoking, and they cause terrible aspects attached to the pathophysiology of this problem. Right from the initial stages where the cholesterol, which is a normal component of human body, it gets modified chemically and gets deposited. There, nicotine aggravates the problem. And cells, the cellular mechanisms, the normal cells of the body go there and then start proliferating and making a plaque. That aspect again, nicotine promotes. The other smoke-related, cigarette smoke-related chemicals promote that factor of that process of atherosclerosis as well. Then, even if the plaque is there, it is usually lined by a fibrous cap, we call it. Sometimes that ruptures and the contents, once they get exposed to the blood, they form a clot. So that rupture also is promoted by smoking. That is the biggest tragedy of this problem because a totally, perfectly so-called healthy person harboring some harmless plaques can, with one cigarette smoke, rupture his plaque and create a thrombus or a blood clot, and his entire life can turn from a perfect health to an utter catastrophe, and in as short a while as 5 to 10 minutes. That is the tragedy of the smoking.
Smoking. We have, I mean, people use tobacco in various forms. It's not just smoking. So people chew the tobacco, or now people talk about even other things like e-cigarettes and hookahs and vaping. So do they all cause the same kind of effects of heart and circulation? And how does it affect the circulatory system apart from the plaques? Does it also damage other organs?
Yes, again, a very interesting, important problem to analyze because the entire vascular tree, wherever the blood flow goes, of course, every part of the human body needs blood flow, and these blood vessels are lined by something called endothelium, which is a single cell layer of cells which prevent blood from clotting. So now we know the importance. Every organ which gets blood needs to have a perfect, healthy endothelium. The first problem for all these issues is the defective endothelium. It won't allow that free flow, nice flow. That is where the disease starts. The harbinger of the entire problem is that, and that is where nicotine affects. It's not just nicotine. There are, as you said, so many 70 other important chemicals out of those 7,000 which can harm this process. Once endothelium gets defective, the entire processes will start, including aggravation of blood pressure. Suddenly the heart rates will go up. In fact, apart from what we're discussing, the coronary disease, heart attacks, paralytic strokes, There are other disorders like, for example, arrhythmias. This nicotine and other chemicals there in the smoke can suddenly make the heart race. The heart rate can go to 150, 180 like that. This is called atrial fibrillation. That itself can precipitate heart failure. That itself can lead to paralytic strokes. So it can cause trouble through electrical system as well. It can also cause a trouble to the weak pumping of the heart, which can be aggravated in smokers. Apart from all these, there are certain peculiar problems. In smokers, certain medicines do not act well. That is another issue. And once you do procedures, if you continue to smoke, if you do a bypass or an angioplasty and try to get them back to health, the phase of secondary prevention starts. That means you had the disease, we have made you back to near normal, and then we have to make sure you won't get the disease back again. That secondary prevention involves the patient's involvement. So he has to make sure that the habits are all modified. And as we said, this is the one important modifiable risk factor which can be modified without much effort in terms of financial or medication advice. It's just a willpower, and it is possible to do that.
So once a person actually, after getting a heart problem, getting treated, and if they do decide to quit, do those symptoms and does the damage to the heart get reversed? Or is it like, if there is a point where, it is too late, now the damage is being done?
Again, very interesting, because this is our question. Usually when people get admitted, heart attack, we do the angioplasty, and while we'll be chatting with him on the bedside while doing the procedure, and then the first question they ask is, am I going to live? Yes, we say yes, absolutely no problem about that. But then, is it going to come back? We tell all the risk factors you have to control. And the question they ask is, if I stop smoking now, are the benefits going to be accrued immediately, or if at all, within a few years at least? The answer is yes. Certain risk components like arrhythmias and plaque ruptures are reversed within as short a time as 1 to 2 weeks. Certain things like, of course, the plaque building up, the inflammation might take even 6 months for to reverse. Certain other aspects like the lung function recovery might take about 2 years. But all the benefits in some way or the other continue to accrue on an incremental basis. So there is a very good impetus and a stimulus for us to cut ourselves out of smoking.
So it's never too late to
The
stop.
question of non-cigarette smoke in the previous question about e-cigarettes and other forms of tobacco.
There is a myth that people sometimes say that they use e-cigarettes or vaping because they are less harmful. So
That's again a very interesting question and commonly asked by the patients.
Yeah.
So if someone is using a tobacco chewing, or if they are doing only some other form like an e-cigarette or some cigar pipes, all of them do contain nicotine without doubt. So nicotine is there. In addition to nicotine, there are some other chemicals as well in that. There might not be too much of tar or some other chemicals which are brought out by high temperature, but still there will be nicotine and some chemicals involved, including some carcinogens. So the effects in the cardiovascular system are going to be there even with those issues. However, one has to also accept the fact that smoking has far more chemicals which can interfere with the cardiovascular health in a bigger way. So sometimes when we talk to the patients and say that now you can go on replacement therapy with nicotine like patches or gums, we are going to use some nicotine there, but that is pure nicotine without all the other chemicals out of it. And that too, that nicotine is going to be used in a step down dosage fashion to get him out of smoking within as short a span as 12 weeks. So again, the other issue is the e-cigarettes. E-cigarettes do also have nicotine. In addition, they have something else called propylene glycol and some other aerosol producing substances, which can again harm the lungs function. There are reports of vapor-induced lung distress syndromes. They indirectly hamper the right side function of the heart. So there are issues with the other aspects of cigarettes delivery forms as well, except for the therapeutic nicotine replacement therapy in the form of patches or gums taken on the advice of doctor under a classical supervised replacement program. One should not take recourse to any of the forms of nicotine for that matter.
So nicotine is something that is so addictive then that it is really, you need something like almost like a withdrawal therapy because it causes withdrawal symptoms. Why is it so difficult to come out of nicotine?
that is one of the most addictive chemicals known to humankind. And if you go back to the history, probably around 1500 or 1600, they somehow someone accidentally found out that it is giving some kick, and then that's how the thing started. And then they took these plants, and then tobacco plants went to Europe and then spread all over the world. Such an addictive drug. Very few drugs are so addictive in the world, and it's become a common available issue now. So it's very difficult to get out of it because it's not just the psychological dependence. There is a real component of physical dependence. The moment nicotine is off in the system, concentration comes down. Sometimes patients' hunger will go up. They cannot do all their activities with the motor impairment. So there is a physical dependence component which really troubles the person when they want to come out of it. There, that is exactly the place where these replacement therapies with gums and patches help. Rest of the times, for those of them where psychological dependence is more, not much of physical dependence, classical willpower is good enough and they can come out of it just like that. For example, our patients with heart attack, they come straight to the cath lab, we do the angioplasty, they become normal, and in the ward, when you're discharging them the next day or so, we caution them and tell them, and we see 75% of them, they never go back to smoking. So there is a role for pure willpower to work, but the scenario where this works well is probably after a catastrophic illness like a heart attack. But it does serve the purpose well.
What about other medicines? Apart from the nicotine patches, we have heard of other medication also to quit nicotine. Are there any other therapies?
There are
Any psychological
therapies when we see someone who is really having physical dependence. From as a cardiologist, when we deal with the patients, we go to the extent of just going to advise only the gums and patches in the classical nicotine replacement therapy. But beyond that, the medication like bupropion and other central acting drugs, we usually hand over the patient's care to appropriate specialists in this area who can monitor and modulate the therapies for them. But for gums and patches, we take ourselves the job on our hands, and then we do direct them. And as I said, the type of patients we see, I am not sure whether I have some magic charm. Most of my patients, wherever we're able to, I think they do come out of smoking. I'm very happy about that.
That's really great. What about women? Is it that, do they get more? Because we know that with alcohol, women have greater side effects and complications with alcohol because of the smaller size of their livers or whatever. Is it the same for smoking? And what about when they are pregnant?
See, smoking in women is fortunately in our country quite low, but maybe in certain pockets it is picking up. And it does definitely cause as much harm in men as in women, and probably, as you rightly said, more because the body surface area, the body weight is lesser. And moreover, women, from the cardiac point of view, they have smaller sized hearts, small sized coronary vessels, and somehow they are also more prone for something called vessel spasm. The blood vessels to the heart, sometimes suddenly they go into spasm, even though there is no block. And then that can cause trouble, that can cause pain, angina, even heart attacks. So somehow smoking and cocaine abuse in women is going to cause these problems more than in men. And of course, if one is pregnant, it does harm the mother as well as the child, growth retardation. There are so many issues involved. And many times, this is one question, sadly, we see couples, young married couples, both into smoking. There will be issues of infertility, there will be issues of erectile dysfunction. And if they get pregnant, again, problems with the fetus, there's a lot of issues involved. I think this is one addictive risk factor which has to be tackled at the first instance they come into the medical contact.
Does it also affect the unborn fetus? What are the,
yes, from a general point of view, yes, right, growth retardation, preterm deliveries, all these are known. But from a cardiac point of view, very rare case reports of excessive nicotine use and heart rate increase in the fetus have been reported. So that is another area of concern.
Because now, as you said, though smoking among women is not so prevalent in our country, but there are certain pockets, and there is again some kind of belief that it will make you not gain weight and these kind of things. So I feel that this kind of myths and all these wrong information that people might be thinking of must be curtailed. So, which is why I asked you this question. Now, we'll take a couple of questions from our viewers. So, is treating heart disease in smokers and nicotine users more complicated?
Uh, uh, in terms of the therapeutic intervention, like say angioplasty or stenting, it doesn't usually make much impact. There's no difference. It's the same way we deal with it. But once you treat it, we don't want the disease to come back, and again the patient has to go for one more procedure. In that area, yes, smokers do get a little bit of more chances of re-narrowings. There's a small controversial area where if you get a heart attack, you use clot busting drugs. Do they work a little bit better in patients who smoke than in those who are not smoking? This is a very controversial area. So overall, we can tell that smokers do fare a little bit worse compared to non-smokers, even in important heart attacks. So it does impact the recovery process.
We also keep hearing about passive smoking, secondhand smoking. So, what is the effect of that on the heart? Supposing there's somebody in a family who's smoking, so people who are exposed, what happens to them? Are they also at risk for cardiac and circulatory problems? And how do you really look at that? How do you prevent that?
It is again true. It is true that even that one has second-hand smoke, so-called or a passive smoke. The environment when you exhale still has a lot of chemicals, still has some amount of nicotine there. And in pockets where too many smokers are there, that area is almost like very strong smoking area. Then, so the inhalation of this itself can lead to cardiac issues. There are instances where people, non-smokers who have been exposed to these pure smoking areas kept aside for smokers have gone in and then ended up with heart attacks within the next 3 hours. One cannot attribute everything to that, but there are instances and anecdotal reports like that. So definitely it does have a harmful effect. And imagine if someone is smoking at home, the children, the spouse, they're all exposed to that. So on the long-term basis, it does carry harmful side effects.
Doctor, I mean, this is something which I'm asking you. You were just saying that, how so many of your patients have, kind of given it up. What is that magic? What do you tell them? How do you make them quit?
So once we're discussing about the disease, we always tell the one realistic fact, that is the disease is not curable. Coronary atherosclerosis, the disease where blood supply of the heart gets blocked. This is not a curable disease. We are only solving the issue once for now. So you want it not to come back, either in the heart or in the other vessels, say other vessels supplying the brain. You don't want the disease to come back again in other areas. You have to cut down on all the risk factors. What I tell our patients is there are only 4 ways of trying to prevent it. One is by appropriate healthy lifestyle, good walks every day, habit modification where smoking interruption is very important, and of course preventive medicines are important as well. I think I'm being bugged by one housefly. Sorry for that.
And what about a stroke? We were talking about how the nicotine affects the brain. Well, does it also pose risk factors for strokes? Is it because of hypertension or because of other factors?
See, there again the same issues. One is, as you said, high blood pressure, which will be a synergistic effect with smoking and causes more stroke. Atrial fibrillation, arrhythmia, the fast heartbeat can be precipitated by nicotine. That can throw clots from the heart and go to the brain and cause stroke. And more commonly, atherosclerosis, the same narrowing of the blood vessels, plaque rupture causes strokes. In the heart, we call heart attacks and other disease. In the brain, it will cause paralytic stroke. So similar pathophysiology, and paradoxically, not even paradoxically, we can say, somehow for some unknown reason, the vessels of the legs, they are affected much, much more by smoking than the vessels of the heart and the brain, which are badly affected. But imagine the vessels of the legs somehow are very badly affected. So people get into the peripheral vascular disease. They cannot walk. When they walk, they get pains, and we have to do angioplasties and stenting. Sometimes they develop gangrene and they land up with amputations. That is one sad part. Another area of blood vessel disease, which is worsened by smoking, is the aorta, the main blood vessel of the body. It develops something called aneurysms. Some areas of the blood vessel aorta, but dilated, they form aneurysms. Sometimes they rupture and cause catastrophe. Why smoking affects these two areas, aorta and the lower limb vessels, in a bigger way than in the other vessels of the body, is a little bit of a perplexing factor. Of course, it's too deep a scientific domain to delve into now.
Okay, sure. So thank you, Dr. Reddy, for this valuable insights that you've given us. And I do hope that our viewers would be motivated, and whoever smokes, or if their loved ones or anybody, their friends or family smoke, I do hope that they will be motivated to quit. And we urge you from Apollo Hospitals that you should gift your lungs with oxygen and not with tar. You should gift your body exercise and not heart and lung disease. You should gift yourself the taste of nutritious and healthy food and not the cigarette butt. And that way you will be gifting yourself life and not death. So on this note, please do quit if you have not already. And we will continue with these FB Live sessions. Do subscribe to our YouTube channel for the latest updates. And of course, you can put in your further comments and questions on our Facebook page. So till we meet again, thank you. Stay safe, stay healthy, and say no to smoking. See you soon. Thank you. Namaste.
Thank you, Srinidhi, and thank you, all the audience, and have a healthy lifestyle.